हेलो। हेलो।
हेलो।
हेलो जी। हेलो।
हाँ, आपकी आवाज आ
Hello. Good afternoon, everyone. Thank you for joining. We will be starting the UP COVID-19 Academy launch session within 5 minutes. We have with us the Honorable VC of UP SDMA, Lieutenant General RP Shahi. We also have with us Dr. Bhanu, who is the chairperson of IAG UP. Professor Vinod Menon has also joined us. He is one of the founder member of NDMA. Then we have Dr. Navneet Ranjan, who is a senior public health specialist. Professor Harsh Kumar Sinha will soon be joining us. Professor is the HOD of Defense and Strategic Studies, Deen Dayal Upadhyay, Gorakhpur University. We have with us Professor Sheila Mishra, who is the international expert for monitoring and evaluation for Sustainable Development Goal. Ma'am is also from Lucknow University, Department of Statistics, and she has been working closely with UPSDMA. VC sir will be joining us soon. And then we have Dr. Madhu Bajpai, who is the team leader of UP and Uttarakhand from WHO. We have Dr. Nirmal Singh from UNES. Honorable VC sir has just joined the session.
Good afternoon, everybody. I'm very happy that today in our program, Honorable VC Lieutenant Colonel General R.P. Sahi has joined us. And this is COVID Academy for UP is being launched today. So I'll request all the participants to be unmuted. Probably all the participants should mute themselves. Oh, just a second. I'm getting something. Please mute all. Hello. Yeah. Yeah. So, am I audible? Anybody can say?
Yes, sir. You are audible.
Yeah. Thank you. Thank you. So, Honorable VC sir is here. And as I said, today we are launching COVID Academy for UP. In this process, just to inform our VC sir that this program is entirely being supported by UPSDMA, or rather you can say facilitated by UPSDMA, Interagency Group, and Lucknow University and Gorakhpur University. And Sphere India is technically supporting the entire process. So I would request Honorable VC to bless this program so that we can initiate the process successfully.
Hello, everybody. Good afternoon to Dr. Bhanu, I am sure that this initiative will definitely help in training and capacity building of the volunteers who are engaged in COVID-19 response Uttar Pradesh. We have a significant number of outreach workers and volunteers from civil society organizations, faith-based organizations, community-based organizations, and will be imparting the knowledge through these virtual training sessions on the topic of COVID-19 commencing 15th December 2020. We all know India is an emerging economic force, economic power at the global level. In 2019, Indian economy had reached around $2.8 trillion, and in PPE terms, we are the third largest economy in the world. As also by 2025, India's GDP is expected to reach $5 trillion, and it will be the youngest nation at that point in time with an average age of 29 years. With more than 1 billion mobile subscribers and over 600 million internet users, India has the potential to emerge as one of the largest digital ecosystems in the world. However, the unprecedented COVID-19 pandemic has slowed down the economies world over. Therefore, our country is also part of that suffering. Nevertheless, now we are on the upbeat, and as we see it, the Indian economy is picking up, and in fact, it is doing much better. And hopefully, in times to come, it will keep improving, and we'll be able to achieve our target of 2025 definitely. As I stated, that the young age group which will be available to the country of 29, who will be highly qualified and to take the country forward in achieving its economic and all other sustainable growth and development. Thanks to the people empowered and people-driven approach, India has kept COVID-19 death rate as one of the lowest in the world, a remarkable achievement. India is also the highest recovery rate of almost 94% and above as on date today. It is again now one of the landmarks that the country has suffered pandemic 19, but our death rate being the lowest, as also the recovery rate being one of the highest in the world, speaks volume of everybody's participation, right from the government direction to the individual levels, including the civil societies, including all the organizations working in pandemic, and especially our first line workers, the health workers, the doctors, and who are involved in directly treating the patients who unfortunately contact this COVID-19. It's a wonderful achievement, and we as Indians should be proud of it. Uttar Pradesh, the largest populated state in the country, and in case of your nation, we would have been the fifth largest population in the world as a nation. I think we have done tremendously well. We are definitely above the national average, and in fact, we drive the national average. And again, kudos to the directions of Honorable Chief Minister, who from day one and even till now is steering the committee by himself and managing the whole show as far as Uttar Pradesh is concerned. We who are staying in the state today are enjoying the benefit of this wonderful directions which he has given, wherein the people who contacted, they received proper treatment, and the preventive measures which have been enforced, which has restricted the spread of this disease in the Uttar Pradesh, I think that is again highly commendable. In fact, the WHO and even Honorable Prime Minister of the country has personally complimented the achievements of Honorable Chief Minister Yogi Adityanath ji. Therefore, we can say that the government response and the measures taken to control this epidemic have been successful so far. And that is why on this topic today, as we inaugurate and we talk of sessions commencing on 15th, we look forward to not only containing it, but totally eradicating. And by that time, hopefully, the vaccination will also be available in our country. But a brief I would like to share with you from what happened, how did it start, and how did we manage right from day one through the pandemic, and what are we doing and looking forward today, so that in times to come, we are able to not only prevent, but totally eradicate this pandemic whatsoever from the state of Uttar Pradesh. I'll briefly talk about the measures taken to control the outbreak. The rate of success of the government actions to curb the outbreak of the disease can be reckoned by relatively low coronavirus positive cases in the state, given the high population density and the low literacy levels in the state, which makes handling of the situation difficult. To get a clearer idea about the measures adopted by the government, directed by the Honorable Chief Minister, I'm dividing the timeline of its actions into pre-lockdown, post-lockdown actions taken to control the spread of the disease. As far as pre-lockdown situation is concerned, the proceeding of the prevention of coronavirus outbreak started in first week of March, before first lockdown was announced on 25th March. A special training programs for frontline workers like medical professionals, police personnel, and all those who are involved was initiated. The Panchayati Raj and the rural and urban development departments were directed to conduct comprehensive awareness program. Through a Chief Minister helpline number, the village heads were asked to make villagers aware of the threat of the new virus. The government issued advisories about do's and don'ts and tips to stay healthy during this time. And I think the population also acted upon. That is a wonderful piece that we take it from here. The government ordered a shutdown of all places of public gatherings, such as educational institutions, cinemas, shopping malls, swimming pools, gyms, multiplexes, tourist spots, till April 2nd. Public transport was put on hold, and it was ensured that nobody roamed in the streets. A helpline was started to assist the public regarding the information about the outbreak. The public was advised to postpone all family events and celebrations like marriages or religious rituals or whatsoever. For any gathering, prior permission had to be taken from the district authorities. Now, what about the lockdown in our state? COVID-19 pandemic in Uttar Pradesh was first confirmed on 4th March 2020 with the first positive case in Ghaziabad. As of 4th December 2020, the state has 5,51,179 confirmed cases, resulting in 7,877 deaths and 5,20,637 recoveries. A great achievement. Case fatality rate in the state stands at 1.4, much below the national average, and of course, world over, we are doing fantastically well. Now, the containment and quarantine strategy. I come to 17th March straight away. The Uttar Pradesh government, headed by the Honorable Chief Minister, extended the closure of all educational institutions, cinemas, and all public places whatsoever. Slaughterhouses in the states were also closed down from 22nd to 24th March. The next timeline, Honorable Chief Minister Yogi Adityanath ji himself announced the lockdown of 15 districts in the state from 22nd to 25th March, including Noida, Ghaziabad, Agra, Aligarh, Allahabad, Kanpur, Varanasi, Bareilly, Lucknow. Saharanpur, Meerut, Lakhimpur, Azamgarh, Firozabad, Gorakhpur, and others, as these states had maximum coronavirus cases within the state as well. Next timeline was 26 May. The Uttar Pradesh government, headed by the Honorable Chief Minister, decided that arriving flights will have to follow 14 days quarantine at their own homes. On 6th day of the home quarantine, flyers can get themselves tested and end the quarantine. Business travelers with a return ticket within 16 days will be exempt, but will not be allowed to enter the containment zones. Now, I'll just share a few statistics as of December 4th, 2020. The total samples tested is almost 2 crores, 1 crore 99 lakhs 60,393 to be precise. Now the COVID-19 positives are 5 lakhs 51,179. And positive percentage is only 2.76. Before I share with you the negative, this thing is 1 lakh. 1 crore 94 lakhs 9,214. Isn't it remarkable? Which was only achieved by the directions of the Honorable Chief Minister and his team 11, which functioned 24/7 in this period to ensure that all inhabitants of Uttar Pradesh are prevented from contacting COVID-19, and should they be contacting COVID-19, the treatment and the follow-up, whether it was home quarantine, it was the medical infrastructures being built up overnight, you name a thing, the workers working overtime, the first-hand workers working overtime, everything of the government machinery was put in place, and rightly so, because the results are speaking for themselves, that what we have done in the almost last 9 months, that not only the state but the world has suffered enormously as far as COVID-19 is concerned. But Uttar Pradesh definitely has done much better as compared to any other state or any other organization. Now, post-lockdown situation, and we are naming it as the Agra model. Just to share with you that something happened in Agra, and the pandemic was almost getting out of control, out of hand. But at that point in time, the Honorable Chief Minister himself took control of the whole situation. And I think Agra emerged as an example of containing, preventing the COVID-19 cases. And according to the Union Health Ministry statement, Agra was the first place in India where a cluster of coronavirus cases were detected. The city saw 6 cases, all of them linked to the man who was the first coronavirus case in Delhi. The administration undertook effective tracking of the first contact tracing. The administration also focused on setting up facilities for isolation, treatment, and testing using the PPP model, that is public-private partnership, investment and model. The supply of food and essential items for those in need was also ensured with doorstep delivery and e-pass facility for movement of essential goods in place. Amid all of this, the district administration also laid ample emphasis on awareness and engagement of the people and established central helplines to reach out to the citizens, and teams for conducting the responses were set up. Notably, the administration left nothing to chance. All efforts were taken to ensure that communication flows seamlessly and food supplies were also reaching along with the medicines were required. The Agra model was a containment strategy which included the subjects like identifying areas within 3 kilometers of the epicenter as containment zone, over 1,200 teams conducting door-to-door surveys of 9.3 lakh people, converting small city control rooms into war rooms where a central helpline was started, monitoring the movement of infected people by drones, CCTV cameras, and mobile phones, GPS, active contact tracing and isolation, citizen awareness and data-driven responses, including the Arogya Setu, uh, as also all the possible methods adopted through information technology methods. The success of the model lay in it being able to stop the disease from spreading beyond the cluster or the area where positive cases were first detected. The district administration of Agra said that the success of the model was due to three key points: isolation, expansion, and containment. Agra, however, witnessed a spike in coronavirus positive cases when Paras Hospital, a private hospital in Agra, repeatedly withheld information about a patient who had tested positive. A total of 79 cases in Agra today are from this hospital, and subsequently more cases were traced to their contacts. The Agra model, which focused on cluster containment strategy, was adopted by entire state. It aimed to contain the outbreak within a defined geographical area by making early detections and breaking the chain of transmission. The containment strategy is implemented by rapid response teams that comprise of civic and police personnel coordinating with the grassroots levels health workers, such as assisted social health activists, ASHA. As far as UP government's relief measures are concerned, the Honorable Chief Minister of Uttar Pradesh was forced to declare that people need not step out of their homes even for essentials such as groceries and medicines, and these were delivered at the doorsteps by police personnel and government-appointed delivery agents and other agencies working under the direct orders of the UP government. Supply lines were created and a helpline number was established as the primary emergency number for all purposes. Apart from the government helpline, the government also issued numbers of grocery stores on March 25th, 26, with a list for door-to-door delivery of the essential commodities. Another factor which we need to analyze today is the migrant. Now, the migrants were the worst affected in such times, not only due to their socio-economic conditions or status, congested neighborhoods, and lack of requisite information, but because they lie outside the state support systems. They're heading from various parts of the nation back to their hometowns once this breakout took place. However, the state of Uttar Pradesh again withstood under the able directions of the Honorable Chief Minister to tackle the spread, minimize the spread of coronavirus within the migrants while they were entering the state and were taken to their hometowns in transport, and all other administrative arrangements were made to ensure that they are taken to their hometowns. Special trains were made, special buses were running, and if they were moving on foot, they were stopped at the respective places by the district magistrates, wherein they were given all their administrative requirements, and then subsequently moved to the home districts. As also almost door-to-door dropping took place during this period. First of all, to prevent, as also to ensure that they don't get affected with the coronavirus. And if we are talking of our villages today, almost being coronavirus free, possibly this step was one of the first and the foremost which helped us to achieve it, because we prevented the migrants to a large extent from contracting a disease, and we went in for a kind of a village quarantine centers which are established at all the villages, and with their all amenities were provided to them, including food, medicine, and whatever requirement was there at the village level, starting with the state capital to districts and to the villages. I think that was a great achievement, and the migrant also co-opted and cooperated in the whole effort of the government. The financial breakdown was, as far as financial outlay was concerned, it was tremendous burden, but it wasn't a burden as far as government of Uttar Pradesh are concerned, because we are saving the human lives. So it was part of the government. I think the Honorable Chief Minister announced it that money will not be a constraint in preventing, as also if a person suffers, in ensuring that he gets the full medical treatment at almost no cost. The rations which are distributed, again, colossal amount of state machinery was put into place for the distribution system of the rations, of the medicines, of the other this thing. In fact, we went through one of the worst monsoon periods also during this time. But as far as Uttar Pradesh is concerned, we stirred out of this pandemic, stirred out of this difficult monsoon time in a way that today we are talking of possibly total prevention of this thing. With little bit of additional effort, I think we'll be able to overcome the ill effects of the coronavirus. Apart from these steps to ease the life of the citizens, the UP government also did its best to bring back the thousands of migrants who were stuck outside the state due to lockdown. I have already covered about it, and I think why I'm again mentioning it, that you'll be surprised that we almost evacuated 50 to 60 lakhs of migrant workers. Again, a very large number, and without any discomfort. Yeah, individual people may have a little bit of this thing, but overall, I think the government, headed by the Honorable Chief Minister, did a wonderful job. As one of the states where 80% of the population is dependent upon agriculture, the Honorable Chief Minister Yogi Adityanath ji also announced several relief packages for the farmers and the migrant workers through Manrega and all other government policies were basically directed, driven by himself to ensure that nobody suffers due to coronavirus pandemic, and everybody lives a healthy life with complete administrative backup of the government. Apart from the humanitarian steps, the government also focused on the need for continued education and learning of students. Soon after the lockdown was announced, the government ordered the officials to start technology-based online classes and for students from primary to class 12 and students, nursing and paramedics, so that academic schedule is not disturbed. The UP government also started broadcasting a 90-minute education program on Doordarshan Uttar Pradesh for students of classes 1 to 8. This step is taken to ensure that the students remain associated with the learning and make constructive use of the lockdown period. The Department of Basic Education Uttar Pradesh also started the e-Pathshalas initiative for the students, making the best use of the limited resources available, as there is no certainty regarding reopening of the schools even after the lockdown is over. Our mantra, Sabka Saath, Sabka Vikas. Now, I would also like to share use of healthy practices to protect people. Hand wash with soap and water for at least 20 seconds, especially after being in public place or after blowing your nose, coughing or sneezing. If soap, water are not readily available, use a hand sanitizer with at least 60% alcohol. A word about sanitizers that we are talking about. When we started, there was hardly any sanitizers being produced in our state, and today we are producing and even sharing our surplus share stocks with other states. Now, that's the way we went about. Anything which was required by the public for fighting, for preventing the coronavirus was made available by the government on the directions of the Honorable Chief Minister. Now, that is where we stand today as far as sanitizers are concerned. Next, coming on to avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick and produce social distancing by keeping at least 6 feet away from others if you go out in public. Wear a clean cloth face covering to cover your mouth and nose when around others and when you must go out in public. The cloth face cover is meant to protect the other in case you are infected. Do not place one on the young children under age 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Cover your nose and mouth with a tissue when coughing or sneezing and throw the tissue away after use at an appropriate place so that others don't get contaminated because of that. And if a tissue isn't available, cough or sneeze into your elbow or sleeves, not in your hands. Clean and disinfect frequently touch surfaces daily. This includes tables, doorknobs, lights, switches, handles, desks, anything which you use daily must be totally sanitized with a sanitizer. Now, at the end of it, I'd like to share the various topics which we are going to be covering starting 15th of December in this web seminar. And first of all, we'll start with the basics of COVID-19, giving you a total background, total summary of how it is started, what all happened, and what is our stand as on, say, 13th or 14th of December. Science, stigmas, solidarity during COVID-19 endemic. Frequently asked questions on coronavirus, responsive parenting for young children in terms of COVID-19, maintaining healthy eating and lifestyle for general population during COVID-19 outbreak, safe environmental sanitation and hygiene during COVID-19 outbreak, infection prevention and control during COVID-19, disability inclusive COVID-19 preparedness and response India. And lastly, welfare of animals in need during COVID-19 crisis. Whatever I have spoken about in last 15 minutes or so, I would like to conclude the opening remarks and with a thank that IAG, ISFAR India, has supported State Disaster Management Authority in organizing this event. And I'm sure all those of you who are going to be attending the event from 15th will further spread it amongst the people of Uttar Pradesh so that we in UP are not only prevented from contacting this pandemic, but totally are in a position to eradicate it soonest to the arrival of vaccination. Therefore, once again, my heartiest congratulations to the organizers and also to all the distinguished participants who are here with us, and more will join us in this journey as we commence on 15th December. With that, thank you so much. It was nice talking with you, and at the same time, take care, stay blessed, stay safe. Jai Hind.
Thank you, sir. Thank you so much for giving such a informative as well as encouraging blessing. And I think all the participants, national level and state level, are really informed about the state. And secondly, the information you had given about 2 crore tests, I mean, that is commendable again. 16 districts which are most crucial, even 16 cities, we can say most crucial today also. The 9 topics which are going to be covered, really it's going to be wonderful. Capacity building for our state people. And the more important thing, that the state could provide support to 60 lakhs of workers, migrant workers who are brought from different places and rehabilitated in the state. So nothing would have been possible without your active and efficient guidance and support. I think voluntary agencies also have done very nicely. The kind of synergy you have brought within the academic institutions, voluntary agencies, government machinery, all, I think it's very important and very nice results it have shown in the state. And that's how everybody could be part of the journey for which I think this COVID-19 could be brought in control in the state. Thank you so much, sir. Now the time has come when we need to listen more about how at national level and at state level and global level could be visualized, and how in future also we are going to see about COVID-19. I request Professor Vinod Menon to give some idea how we need to go ahead in the state for COVID-19 Academy for Uttar Pradesh. Professor Vinod Menon. By the time he is linked, I'll request you to understand more about Professor Vinod Menon. He is a former NDMA member, and he has supported the entire process and last few emergencies in the country, like Kerala emergency, like Bihar emergency, and all that. So in all these places, the kind of support he has provided to civil society is commendable. And
thank you, Dr. Panu. Thank you very much.
I request Professor Menon to say, to enlighten us about the journey and about how we need to move here.
Thank you very much, Dr. Bhanu. General Sahi, actually, I'm very delighted to hear a very detailed expose on the way in which Uttar Pradesh has actually managed to come out very successfully in the past few months, by very conscious strategies of intervention. And as you mentioned, we have now more than 5,54,000 people infected by COVID in Uttar Pradesh, but you only had 7,924 deaths. And this, I think, has been largely possible because of the contribution and the efforts, the dedication of the frontline health workers, the doctors, the nurses, the paramedical staff, and also the conservancy staff, the housekeeping and conservancy staff in the hospitals. And we have actually seen the way in which the Anganwadi workers, the ASHA workers, and the elected representatives, the government officials, the civil society organizations representatives, and the general public, how they have been actually responding to make sure that compliance and enforcement is necessary. We have seen that the enormous testing which was actually achieved in Uttar Pradesh, you have actually had more than 2 crore tests, which has actually also seen the positivity rate of 2.73% compared to the much worse situation in several other states. And if you really look at the total number, and General Sahi mentioned actually the number from the Uttar Pradesh, but if you really look at this as a global pandemic, which has actually affected 218 countries, I think we would need to recognize that more than 67 million people have been infected. And we have lost more than 1.5 million people all over the world. And in India, we have more than 96 lakh people infected, and we lost 1,40,000 people. And these are official records. Now, if you really look at the way in which we have been able to contain this spread through a lot of efforts, we still see that the disease is out there, the virus is out there. And we need to be very conscious of this fact, because ICMR's serosurveillance study report of the study conducted, the surveys conducted in August mentioned that 74 million people, that is almost 7.4 crore people, could have been infected by August 2020. And this number of 7.5 crores would be more now, because we have actually been seeing the festivals, we have been seeing also the onset of winter, we're seeing the wedding season, and there have been also a lot of violations happening, and we see that also in the crowded markets because of festivals. And now we also see that with the restaurants and the unlocking happening. We have gone through 5 locking versions. The lockdown 1.0 to lockdown 5.0 from March to the past few months when we started the unlocking, and we have had 5 unlockings. Now, I would like to basically mention the effort in terms of the successes which we have attained are impressive, but at the same time, we need to also recognize that we have had very serious losses of lives. 1.5 lakh people, 1,50,000 people, losing lives. 1.5, we have this number of 1.5 million people, who have been, who have lost their lives over the world, and in India it is 1,40,590. So losing 1.5 lakh people as per official records is actually very painful. And we've also seen that levels of preparedness in many states were not actually as impressive in terms of preparedness, because when the lockdown started, the lockdown was used by many countries to prepare themselves in terms of stockpiling of PPEs, N95 masks, and also testing kits, and start rolling out the preparations for emergency response. However, we have seen that in many states we were not really having that kind of facilities. The labs had to be set up. We had to put together the logistics, the supply chain logistics for distributing these testing kits and so on. So there was a lot of problems which we saw, including the travel of migrants, several lakhs of people traveling across states. And, we have also listened to another part of Uttar Pradesh's success, also in terms of using NREGA for employment generation of the migrant workers, was something which we need to acknowledge, that, the process of recovery and, in terms of social protection, for ensuring that people have wages, people have income, people have food security is extremely important. So I'm sure that, we will actually be seeing more of it. But we need to also recognize that we are now talking in 2020, and whether 2020 is a lost year for most people is something which we have actually, to really address. 2020 is a lost year, and, all the impressive gains of Sustainable Development Goals, SDGs, which we have achieved in the last 5 years, we actually are facing a huge setback. And there is a study which has been done by UNDP along with the Pardee Center for International Futures in the University of Denver, which was just released a few days ago, which says that there are 3 scenarios. The first scenario talks about the COVID-19 baseline. The second scenario talks about a high damage scenario, what will happen if the current situation continues. And we also have a big SDG push scenario. In the first scenario, COVID baseline, the number of people who are getting pushed into extreme poverty is 44 million. And in the high damage scenario, the number of people would be getting pushed into extreme poverty is 207 million. So altogether, about 207 plus 44, 251 million people would be pushed into extreme poverty by 2030. So we need to really look at strategies. And that is where, I would request everybody participating in this academy, the COVID-19 Academy, to recognize that we cannot compartmentalize solutions. There was a study by UNICEF, which has actually come out during the Children's Day, which said, a 6-point plan to respond, recover, and reimagine a post-COVID-19 world for every child. And this also had a subtitle. It said 2020, a lost year, to avert a lost generation, a lost COVID-19 generation. We need to have a 6-point plan to really respond more effectively. Now, you have seen this also for elderly people. You have seen that also for people with disabilities. International days were observed for these, for people, transgender people, for elderly people, for children, for, indigenous people, indigenous communities. So we've had several international days observed, but we need to understand that this is a problem for humanity. So that is my request to everybody. Don't look at compartmentalizing this for our own constituencies. And when you look at the WHO or UNICEF or WFP addressing this problem, we have to see it not from our own sectors alone, but from the total, holistic approach to solving the problems of humanity. And if you do that, we can actually make 2020 to 2030 a decade of hope. How do we make this 2020 to 2030 a decade of hope? Because we have sustainable development goals. We have the Sendai framework for disaster risk reduction. We have the Paris Agreement of climate change. And then we have the new urban agenda. And all these would look at vulnerability reduction. All these would look at weaker sections. All these would look at leave no one behind. And all these would also highlight do no harm approaches. And how do we really ensure that this happens? We have to make sure that there is no exclusion. We do not leave anyone behind. And that would mean that all vulnerable sections will be addressed, whether it is migrant workers, whether it is people with disabilities, whether it is people who are transgender, whether it is elderly people, all these, palliative care patients, all of them need to be accommodated, and it has to be an inclusive process. And inclusion means it is social inclusion, physical inclusion, financial inclusion, electoral inclusion, and digital inclusion. Because now on mobile phones, we are able to communicate. When we saw the COVID-19, the people who are dealing with education understand that opening of schools and opening of colleges through online classes was actually creating huge challenges in many parts of our country. And you have seen that in your own fields where you're working. You've seen that the children did not have smartphones or laptops or internet access or data plans to attend to classes. And these are challenges. And we need to understand that we have actually made a lot of difference in the way in which we were addressing this, but we've also seen the pain, we have seen the anguish, we have also seen people committing suicides. We've also, I'm sure many of you may have also read the news items saying that there was a poor, agricultural laborer who actually had access to a cow, but he sold his cow to buy a smartphone so that his child could attend classes. And the cow was only the asset for him, but the cow has to be sold. A distress sale had to be done so that he could buy a smartphone for his child. Now these are very tragic circumstances. We've also heard about people committing suicides because they have lost their jobs, they have lost their opportunity for ensuring support to the families. So these are some of the problems, and I am sure that we will be looking into some of these. And my request to General Sahi is that several years ago, we had discussed about developing a policy for Uttar Pradesh, a disaster management policy, a disaster risk reduction policy. Oxfam was involved in that. Dr. Bhanu was very actively involved in that. Myself, we all sat together, had consultations with the UP SDMA and prepared a document. And that document is available. And I would request that we look at these policies, because policies are important. Policy is a statement of intent. And we need to involve stakeholder groups. We need to involve the Jilla Parishads, the Panchayat Raj institutions, the elected representatives, self-help groups, women's groups, and everybody. And I hope that, whatever impressive, successes which we have seen in the early months of the COVID, it's going to be a long haul. And I hope that, we will actually be seeing, Uttar Pradesh, setting certain good practices, which will actually inspire, people in other states by being inclusive, by being open, by being also, open to accepting different opinions of people without considering, people from, divisions on the basis of caste, class, gender, or religion. And that is extremely important. And we have to be more humane in our approaches. And I hope that I wish the COVID-19 Academy all the very best. And I look forward to seeing a lot of positive outcomes by taking the messages forward. And I wish all the very best to the COVID Academy in Uttar Pradesh, and also look forward to seeing the outcomes with the collaboration of WHO, UNICEF, IAG Uttar Pradesh, Sphere India, HCL Foundation, and all the other partners. Thank you very much for this opportunity.
Thank you, sir. Thank you, Professor Menon. I think it was really full of information and eye-opener for us to listen to you. Right? But very importantly, you have said that this year, this decade should be made, the coming decade should be made a decade of hope. I mean, that is because everywhere you are seeing negative things and negative information, people are adding very differently to it. So with inclusive and openness, I think very nicely you could instill hope within the society and within our humanitarian sector. The other important thing what you were asking, I think your request to Professor General Sahi was for state policy. I think he did ask the moment he joined UPSDMA, he did ask for those documents which we have been preparing and which were prepared, and he has taken action. Most of the things are pending with the system and maybe cleared soon. So now I think it's time we need to listen to Professor Sheila ma'am. Professor Sheila Mishra, she is basically an statistician. She is a professor in University of Lucknow. But more than that, she is a person who is very much into SDGs, who is very much into Sendai framework, and all those people who are working under her, she make them that to understand the problem, the disaster, and their consequences, and making connect to the education system with these developmental things. So how all the researches can be made properly and can be connected to development system, rather than for just academic system that study or research has to be done for the sake of research, for the topic identified by those professors who do not connect it with the development, regular development. So she makes lots of effort to bring all these things into the academic session, and she's a person from University of Lucknow assigned the role for 10-point agenda to be brought into the mainstream of education curriculum of higher studies. So for that purpose, for that reason, she is connecting all the universities, maybe in UP or other outside UP. So that's how, and she is doing many more things in the system. And one more important thing, for women, she is like anything. Government of UP also has given lots of responsibilities in Mission Shakti. University has given lots of responsibility for how to bring things in a positive manner. So I think we would be very fortunate to listen to her about how situations are and how we need to move ahead. So I'll request Professor Sheila ma'am, please guide us and provide your inputs so that COVID Academy for UP goes further and goes to people. Professor Sheila ma'am, please. Till the internet connectivity is being established, I'll just give you more inputs how UP is taking lead into the entire process. You may be knowing the population of Uttar Pradesh is very heavy, and at the moment I think people are becoming reluctant. They are not taking COVID so seriously as they have been taking in the month of March, April kind of thing. And this is the period when you don't remain, you are not so sensitive as you were. Probably this reluctance may be a killing factor, maybe a troublesome factor. So I think our important way of condoning, important way of sorry, it's some echo is there. I'll yeah.
I'm connected, sir.
Okay, now she is connected. So I'll request, without wasting time, I'll request Professor Sheila ma'am to provide her inputs for COVID Academy Uttar Pradesh, and let's see how best we can do from the team. Thank you, Dr. Sheila ma'am, please.
Namaskar. Thank you so much, Dr. Bhanu. And I'm thankful to the forum of UP State COVID Academy, which is being launched today to do as much as we can do to eradicate this COVID-19 pandemic, which has had a huge impact on everybody's life. No one is left unaffected. So we would like to have a glance at how it is affecting different sections of the society. Is it same or it is different? Whether men, women, rich, poor, literate, illiterate, everyone is having the same impact, or there is some difference. So my topic of talk today is the impact of COVID-19 on women. And as we know, and this has been a concern worldwide, like the disease doesn't discriminate between men and women, but definitely the response and the impact of the disease, it is different on men and women. So I would like the sharing of the screen, the second page of the screen to be shared. So if it is possible, I have just asked the host to share the screen, and even if it is not, then I'm just going to tell you. But I'm not able to see the screen, so I don't know which page you are at. Just a moment. Slideshow, please, slideshow. Slideshow. Yeah, you can share from here only. So as we know, most of the time, we feel like we are talking about the human population as a whole. You have heard just previous speakers, Dr. Bhanu and the Vice Chairman of UPSDMA, that so many people have been affected by the disease, and so many have recovered, so many have fallen the prey to the disease. But what is the status of women? That we need to understand. So, how to, please, okay, yeah, it's coming, but how to change it? Scroll?
No, it's happening from here. This one.
Okay, so does coronavirus affect men and women differently? Of course it does.
Next slide.
Next, please. As we know, like the healthcare workers, they are the frontline workers. We call them corona warriors. And 70% of healthcare workers are women. And these are the people who have the double responsibility of looking at the career professional front as healthcare worker, and also do all the responsibilities for their home care and for other social care. Next, please. Next slide, please. And as we know, like earlier also, stop here, please. Stop here. So women are economically also, they have suffered a lot. Many women are in the unorganized sector, and they have the maximum fear of losing their job. Many have already lost, as you know, like the women who used to work in the homes, or who used to do some kind of daily activity, selling the things to the local communities. So all those things have already stopped. Next, please. Next slide, please. Yes. So 41% of women are employed in the sectors which are at high risk of job losses in comparison to men, which is 35%. Next, please. Next, please. Yes. And also the attitude towards the women at home and in the society and at the workplace, that is also giving them a tough time. If they need to take care of the people at home, then they are like pressed to leave the job, because it happens that they earn less, so they are compelled to leave the job. Or even if there is a lack of food at home, so they are the people who are getting the food at the last point of time, or they are not getting it at all. So these are the things we need to look at, the social attitudinal behavior in the social framework and at the familial level both. Next, please. Next slide, please. Yeah, and domestic violence also. We all know, like we were asked to stay at home for the maximum time during the lockdown period. And even after unlock started, we were asked to stay home maximum time at home. And this has raised the level of gender-based violence all across the globe, irrespective of the countries. So the developed countries, and India is also not an exception, more than 50% rise in domestic violence has been seen, as reported by the National Commission for Women. This is the earlier data that might have even increased at the moment. Next, please. Yeah, so it is a reminder that it is a reality everywhere, be it home or be it workplace or the public space. The women are suffering some kind of the violence because of the gender, because of being women only. Next, please. Yeah, and also they have the least access to the healthcare facilities. The pregnant women with low immunity and less access to health facilities, they also have the increased risk of getting the disease, and also to have a healthy lifestyle. So that is also a challenge for women. Next, please. Next, please. And it has been found in a survey, the earlier one, first one. The first one. Yes, it has been found in the survey that 50% girls we are uncertain to school are. So this is also a huge concern, like the education and health facilities. They are not working in the same way as they are working for the boys. And the survey has also showed that COVID-19 has negated girls more than boys. Data on time use reveals a clearly gendered pattern, with 64% girls spending their time on course and care work and 78% of boys is spending time on the laser, as stated. And the domestic core, they need to do even during their online education, or if they are not having enough technological gadgets at home, then it is the boys who are getting access to the online facilities, education, and other things, not the girls. And we have heard about even the suicide by the girl students for not being able to attend the classes. So this is a huge concern for everybody. Next, please. And we have also seen that the poverty, that is also going to be a great concern all over the world. We have heard earlier speakers as well. So it is worsening. The gender poverty gap, this is also worsening. And the women, the latest adjusted forecast is 232 million women. They are going to be in the extreme poverty. So of course, this is going to have impact, a negative impact on all dimensions of their lives. Next, please. Next slide, please. Yeah. So the latest report says that the pandemic will push 96 million people into extreme poverty in 2021, and 47 million of whom are women and girls. So this will bring the total number of women and girls living on US dollar 1.90 or less to 435 million. Next, please. Next slide, please. Yeah. So more concern is that the extreme poverty is affecting the women who are between the age of 25 to 34, which is the most productive age in their career and in the family formation, both the aspects. So the impact is going to be huge. It is expected that there will be 118 women ages 25 to 34 in extreme poverty for every 100 men aged 24 to 34 in extreme poverty globally. And this ratio could rise to 121 poor women for every 100 poor men by 2030. So if so many women are living in extreme poverty, you can imagine how the next generation is going to be, how it is going to impact the infant mortality rate, how it is going to have impact on maternal mortality rate, how it is going to have the impact on the mental status of the children born to these women, or to all the family members, to the persons who are depending for care on these women. If these women are themselves not in a position to be healthy from within, from mentally, physically, and not having enough nourishment, so how are they going to take care of the family, elderly, or and also, like women are overrepresented in many of the industries hardest hit by COVID-19. That means there are more women there who used to work in food service, retail, and entertainment, and then they are going to lose their jobs. So that is also the livelihood issue is a great challenge in front of women. Next, please. And for domestic workers, 80% of whom are women, the situation has been dire around the world. A staggering 72% of domestic workers have lost their jobs. Even before the pandemic, paid domestic work, like many other informal economy jobs, lacked basic workers' protection like paid leave or notice period of anything. They were just thrown out of their job without any consideration. And that is the reality in many spheres of life. Next, please. Next, please. Yes. So inequality at home and unpaid care also. We know that women spend an average of 4.1 hours per day performing unpaid work, while men spent only 1.7 hours. That means women did 3 times more unpaid care work than men worldwide. And now, when we know like school and daycares are closed and people are working from home, so this unpaid work has increased multiple times. So this is an additional work for women, and even working mothers, they are not having any other option. So balancing the full-time employment with childcare, with schooling responsibilities, taking care of elderlies, this is putting tremendous pressure on women who are already burdened with the huge unpaid care work. Next, please. Next, please. Yes. So this estimate shows that an additional 11 million girls may leave school by the end of COVID crisis. Evidence from previous crisis suggests that many will not return. Next, please. Next slide. And economic insecurity is not just about jobs and income loss today. It has a snowball effect on the lives of women and girls for years to come. Impact on education and employment have long-lasting consequences that, if unaddressed, will reverse hard-won gains in gender equality. And that is also going to impact all the sustainable development goals we are talking about, and the efforts which have been made so far may be really again taking a U-turn, going back those benefits. Widening education gender gap has serious implications for women, including a significant reduction in what they earn and how. And an increase in teen pregnancy and child marriages. That is also a great issue. Next, please. Next. Lack of education and economic insecurity also increase the risk of gender-based violence without sufficient economic resources. Women are unable to escape abusive partners and face a greater threat of sexual exploitation and trafficking too. Next, please. And the worst is that the 49 countries, they lack even laws protecting women from domestic violence. This is a great concern. Next. So these consequences won't disappear when the pandemic subsides. Women are likely to experience long-term setbacks in workforce participation and income. Impacts on pensions and savings will have implications for women's economic security far down the road. The fallout will be most severe for the most vulnerable women among us. For example, the migrant workers, refugees, marginalized racial and ethnic groups, single parenting households, and all these underprivileged sections of the society. The women, they will be most affected and worst hit. Next, please. So here, as you see, the men and women's need, it is different. They are not same. They have different physical need, they have different mental need, they have different social needs, and the attitude and behavior towards them is different in the society. So we need to have special customized policies to help women to get out of this pandemic blues. That is essentially have to be taken care of whenever we are framing the policies. Next, please. Yeah, and violence against women and COVID-19, this has also been a great challenge because, social distancing and stay at home, that has increased the domestic violence, the loss of livelihood, that has made women and girls vulnerable to sexual violence, abduction, trafficking, and all those things. And increased burden on governmental system and structure that has decreased the input in the welfare schemes or in all those facilities which were there to help out the women. So they are suffering at that front also. Next, please. So impact on system and services. The system and institutions for provisions of essential services to women and girls affected by violence, such as police, health, legal aid, justice, counseling centers, helpline, shelter, are likely to be weakened or overburdened during times of crisis. So community support structures and protection mechanism, they are likely to be destroyed or disrupted. So I will just like you to quickly switch the slides, and then I will stop you. So important issues, yes, this one I would like to focus. The increased vulnerability to gender-based violence, the unemployment, economic and livelihood impact for the poorest women and girls, unequal burden of care leading to increased vulnerability of COVID-19 transmission, low access to life-saving health information, especially by women and girls most left behind, and the policy prevention and response mechanism, which is, if it is not gender responsive, then it needs to have the gender disaggregated data to frame the gender responsive policies to take care of all these issues. Next, please. So because of the lack of the time, I will just like to switch the slides. Please switch it. I will, yes, next. Next, please. Yes, so there are some points which need to be done. Yes, please stop here. So focus, the gender responsive approach needs focus on inequalities and difference between and among men and women, boys and girls. If you decide to work with women because of the discrimination they face, initiatives should be based on a thorough analysis of gender roles and relationships to recognize that both women and men are agents of change and active participants in their communities. So do not label women as victims, recognize and acknowledge the importance of their roles they play in the lives and in the nation building, and design interventions that take into account inequalities and differences between women and men. Structure resources so that programs recognize inequalities and attempt to rectify them. Understand the differences among and between different groups of women and men based on criteria such as socio-economic status, ethnicity, religion, age, etc. And you need to encourage participation based on whatever is their specific need, and the customized things are to be taken care of. Next, please. So please come to the point, second point. Yeah, second point is to support for women-owned and led business. Third point, please, next slide. Third is support women workers. And the next one is support for informal workers. Make the unorganized sector the organized one, like giving them skills and promoting them to bring into the formal sector. Make it organized so that they don't have the fear of losing their jobs or their earnings all of a sudden. Next, please. And recognition of paid and unpaid work. That has to be balanced at home also, at the work front also. Next, please. So these data have been taken from the UN Women website. Next, please. So thank you so much. And we know that for making the pandemic blues away from our society, we have to address the problems of men and women and all sections of the society, depending upon their needs and their capabilities and their weaknesses and their strength. And women being the pillar or the center of their family. If women is weak, the family becomes weak. If family is weak, society becomes weak. If society is weak, the nation becomes weak. So if we are going to take care of the women's strength, we are definitely going to take care of the nation at large. Thank you so much. And thank you for your patient hearing.
Thank you, Sheila ma'am. Thank you so much for giving such a nice vision, and really, I mean, those steps which can really break the cycle of vicious cycle of poverty and gender biased initiatives. I think very important thing what you told is unequal burden over women. That is very important, and we must have gender responsive approach, because unless we have gender responsive approach, probably things are not going to be normal in the society. If women are not healthy, if women are not conscious, if women are not in the mainstream, as you rightly said, that 232 million women are going to be forced to be in the poverty, and the ratio between men and women is, I mean, the stake of women are more higher. It is going to be 100 versus 121 kind of thing. So those things are going to be very important for our future strategy, how to plan and how to plan our capacity building. And I think here we have got our very important resource person, Dr. Vikasendu Agrawal. Dr. Vikasendu Agrawal is a person who is a surveillance officer for the state for COVID, and he is the person who have got all data, all information about the state, what is happening where, and what is what needs to be done further. So I think seeing all these speakers and the kind of concerns that has been shown, I'll request Dr. Vikasendu Agrawal to give some idea as what exactly civil society can do, what exactly government needs, government expects from civil society, and what is the situation where you need that support could be provided. So these few things, I think, and maybe you are more versed with the situation. So all relevant things you can tell us, and that we will try that how COVID Academy can take it up, and in time to come, your support can also be taken. So Dr. Vikasendu Agrawal, please. Unmute करो. Unmute करो.
Okay, I am unmuted. Thanks, Banuji. So first of all, I am very happy to see such a useful gathering of personalities from different walks of life. And we have gathered here to review the situation, COVID situation in Uttar Pradesh, and what the state has been doing, and what can be done further to reduce morbidity and mortality due to COVID 2019. So as Menon sir has rightly said, that it has to be an interdepartmental effort, and all sections of societies, all departments of governments have to come together to fight this pandemic. So I am, first of all, let me give you a brief overview of what the state has been doing. In most of the areas where interdepartmental coordination or coordination with different non-government organizations, partner agencies is concerned, the state has been pursuing this agenda very vigorously and very actively. And most of the health partners who are here today, like WHO, UNICEF, Professor Sheila from Lucknow University, we have been in contact with each other, and we have been interacting very actively with each other. In fact, UNICEF and WHO are part of our COVID core committee, which holds the meetings, the decision-making meetings almost every second day now, and previously it was almost every day. And we have earlier interacted with Dr. Sushila also, Professor Sushila also, and we have trained a big number of volunteers that she asked us to train from the civil society. So having said that, I must say that situation as of now in Uttar Pradesh seems to be pretty much under control. And as compared to the national data, we are faring quite well. The positivity percentage in Uttar Pradesh overall is around 2.7%. And case fatality rate for COVID is 1.4%. Both of these indicators are lesser than the national average. The positivity rate at national level is around 6.5%, and case fatality rate at the national level is 1.5%. And we have handled 2 large waves of migrants, and we have done so very successfully with very active support from UNICEF and WHO and PATH and other partner agencies. And in fact, we were able to log in records of around 50 lakh migrants who came to UP from different parts of India. And we were able to isolate them, to quarantine them outside the villages, in meeting halls, in marriage houses, in local schools. And we were able to provide them logistics and the necessary material for their sustenance, and also the employment avenues were opened up for them. And Rahat Ayukt, Office of Rahat Ayukt UP has done wonders in catering to this migratory population. And overall the impact, which was it was being said that it will be great in UP, and we will start getting a very huge number of cases. But because of interdepartmental cooperation, because of cooperation between different stakeholders like UNICEF and WHO, and because of very active community participation in the form of well-trained village and mohalla nigrani samitis, we have been able to contain the infection when large numbers of migrants came in. And now after that, we had a peak in the month of September when we saw a large number of cases, which were for the most part of September to the tune of 6,000, 6,500 per day. And in fact, for 2 days, we crossed the number of 7,000 also. But that was our peak. And when we look at other states in UP, like Maharashtra, like Gujarat, like Rajasthan, like Delhi, so compared to their population, we are many times more. But because of very active participation from the top executive and political top of the political establishment and timely interventions, the numbers in UP has not swelled that fast. So this is the ground situation. But right now, when everything is opening up, schools are opening up, malls are opening up, theaters are opening up, and life is every effort is being made to put life back on track. It is very necessary to involve public in a big way. And in fact, apart from a few districts, we have not been very successful in this part, in this particular area, involvement of public in COVID containment activities. So most of the interdepartmental and NGO sector cooperation we have achieved, and we are doing very successfully on these two fronts. But involvement is public is something which needs to be strengthened further. And we need all the support from every quarter that we can get, including from COVID Academy, in involving general public in COVID mitigation, in COVID control efforts. And that is where we have to think how COVID Academy can be of use to the state. So this is my take on activities of COVID Academy. And I will be very glad to hear from any of you if you have some plan, if you have some thoughts on this particular topic, how we can involve public in COVID containment activities. That will be very great, and that will cover the last mile that we need to cover in COVID containment, for COVID containment. That's all. Thank you very much.
Thank you so much for providing us the real information, the real picture, what you told about the state, and how bravely we have gone through the last wave. My mic. It's am I audible?
Yes, yes, you are.
Everybody?
You are audible.
Thank you, sir. Thank you. So I think the way you have given the idea how state has been doing and how nicely we could contain the entire process with your support and your guidance. One activity has already been initiated that how volunteers can be brought into the mainstream, and they can help containing the process, interacting with the society. Positive cases can become responsible of citizens, and then they can be supported morally as well as their regular interaction, and then supporting from whatever need they do have. So that process is on, and probably till today we have got more than 70 volunteers registered in that. And as we promised, when we are going to have 100, maybe within a day or two, we will come back to you. So that is one important thing what you have been asking and requesting, and many more things I think we will be coming up with your guidance. The very important thing what is today, maybe as people said that in the last 8-9 months we have understood how COVID is moving, but because it is new things, we don't know what is going to happen even post COVID. Are those people who are infected, how they are going to behave? Maybe that is another important thing which we need to understand, and whatever information is available could be added to our coming COVID Academy capacity building session. Now we have got another very important person with us who has been working internationally in the health system, public health system, Dr. Navneet Ranjan. Dr. Navneet Ranjan has worked with many organizations and NIHFW, National Institute of Health and Family Welfare in India, and then after that many other organizations in the world he has been working with, and now he is based in Lucknow after working in so many countries. So I'll request Dr. Navneet Ranjan to give local and global perspective about COVID-19 so that we can include those important things which we may be missing if it is not there. So Dr. Navneet Ranjan, please. Somebody can unmute Dr. Navneet Ranjan, please. Sir, you are unmuted.
Yep. Thank you very much. Thank you very much, Dr. Bhanu, for this opportunity to witness the launch of this COVID-19 Academy. And I also welcome all the participant attendees and the dignitaries who are here, and I have been listening to all of them, and I was really enlightened to listen the information, the amount of information and the content that they are delivering. So it's really very, very useful for us. And I'd also like to congratulate UPSDMA, Sphere India, and IAJ UP for this, the tremendous task of creating a series of training for the volunteers, for the community regarding this, the COVID pandemic. So really, it's a very tough time for all of us, and we have been, living in this time with so much of pressure, so much of the restrictions, and this gives us a strength also to overcome the situation that we are in the coming phase of time. So in this current situation, I would like to divide my talk in 2-3 points. Basically, what happened in the past and what we're supposed to do in the future. So if you'll see the COVID-19 pandemic, and this is something that started a year ago, and we all know about how it begins and how it progressed. So in the continuation part, we also know that how this give us the opportunity to realize ourselves within ourselves, and how to give the society back. So all these things comes under 2-3 points. One is about the health service delivery preparedness. So as we already mentioned that the India as a country and the Uttar Pradesh as a state did a very remarkable work in terms of control of this pandemic, and definitely the case recovery rate is very good in at the national level, which is 94.32%, And in Uttar Pradesh is slightly higher, so our recovery rate is higher than the national average. Similarly, it's about all the precautions that we are taking, all the measures that is given by the government as well as the community and the civil societies. So this definitely has a great impact to save our lives, but unfortunately there are several lives we lost. We lost many the important lives, particularly from the frontline workers, those are working in the hospital settings, as well as those who are working in the welfare of the community. So what we are trying to do in future, that's our more focused thing. So first of all, I'd like to draw another point is about the importance of lockdown. So when the lockdown started, we are trying to understand this disease, because this is the novel coronavirus and we were not able to interpret what's the behavior of this virus, how this is going to impact the lives, impact the the physiology of our human body. So this lockdown gives us the advantage to strengthen our health systems as well as to understand the disease. So we see that there are several lockdowns have been imposed in terms of 1, 2, 3, 4, 5, and then further it's a unlock phase happened. But during this phase, we have been able to strengthen our health facilities. We have been able to identify our L1, L2, L3, the facilities. We are trying to get the hospitals more empowered, more facilitated to taking care of the people who really need the actual hospital based care. But before that, we have to also take the advantage of the technology to create a digital platform. So I can say that when the COVID testing was done, then that is the one step. And in the another step, if you would like to get the report, then you can directly download it from the website. So it gives an added advantage for the people who are not coming again and again to the facility to get to get exposed to the virus. So this is one of the platform, the technological platform, which has been widely used and accepted in the healthcare systems. So telemedicine is one of the thing where we have been able to get the consultation from the doctors, as well as mobile medical units are widely used, especially in the state of Uttar Pradesh, and they have been widely utilized for this for the purpose of this COVID screening, as well as providing the IEC to the community. So with all these information and whatever we have learned in the through this entire process, either it's globally or the locally, we would like to share this knowledge. We should have to create a knowledge base, and this knowledge base could be taken as a part of the institutional memory, so we can do it if any similar kind of the infectious disease type of pandemic or can happen in the future. So we can have learned from these our past learnings, and we can do it. So we have several plannings, and it's rightly said that if you are not planned for unplanned, means you are not planned. So let's our learning and the knowledge base will be useful for any further such infectious disease outbreaks. And I can confidently say that we will not let us this crisis to define us, but to refine us for the better living world for everyone. So I think by this saying, I would like to congratulate the UPSDMA once again for this, the launch of this COVID-19 Academy. And definitely we will work together for further strengthen this. And as rightly asked, Dr. Vikasendu Agrawal about the community participation, how we can engage the community or the people of Uttar Pradesh to to cut the chain of this transmission. So we will work on this, and definitely it will be helpful for the closure of this pandemic. So thank you very much once again. Now I would like to stop myself here.
Navneet, what I have to say about this is that we, like community participation, we already have around 50,000 mohalla and village Nigrani Samitis. The thing is, over past, when they were made, they were initiated in the very beginning, in the month of April. They were all very enthusiastic. They were all participating very aggressively in the campaign. But now over a period of time, their level of enthusiasm has gone down and level of participation also has gone down, number one. Number one, we have to maintain the momentum. We have to keep them enthused. And number two, we have to find some new volunteers also, some educated persons. Like there is an Agra model, which I had explained to Dr. Bhanu, where what Agra is doing, they have a cadre of around 2,500 volunteers from different organizations. And for every positive patient, they delegate one single volunteer. And that volunteer calls the family. If something has to be brought from the market, that volunteers will go to the market, get it for the family, so that there is a minimal movement of family members of positive patients into the society. So that way they have been able to contain it very well. So there might be many, this is just a single model which came across recently. There might be many more models, and there might be many more different ways in which we can involve volunteers. So we have to find out some new ways, some new avenues of involvement, of cooperation, and we have to bring in some new fresh blood, some active youth, educated active youth into the community, into this network of organizations which are fighting COVID. So that is what I had in mind. If you have any suggestions on that, we are always open to it. And this is one particular facet which need to be addressed immediately. Right. Thank you.
Yeah, I think this is a great idea for adding some more new volunteers into the system. That definitely gives a fresh idea about it. And I also think that there should be a capacity building of those volunteers. So this can be used for for any other similar kind of activity. And for that, I always think that there should be some blended approach. So there are some online learning, plus some, the one-to-one contact is also required or maybe important for them. So the capacity building is one of the thing, and that could be a blended approach in the current COVID situation. So this is really a very innovative idea, I can say, and we can start involving new persons through our online drive, and there people can voluntarily register them, and they can get some kind of recognition, maybe some certification, or maybe something, some reward to them. So this is one of the thing that's currently in my mind, and definitely we will work together in future for for a strength in this.
All right.
And one more thing I would like to add at the end, since this talk is still going on. One is about in this pandemic, we also come across this misinfodemic. So there are lots of misconceptions, misinformation is passing through this digital platform and all. Although there are several regulatory ministries are there. For example, for health related, we have a Ministry of Health and Family Welfare. They are regularly providing the guidelines, and it's already updated. And even at the Ministry of Health, there is one whole booklet is there where we have the list of guidelines, when and where these kind of guidelines were, the launched. So there is one whole booklet is there. Similarly, we have FSSSI. They are providing the guidance for the how to handle the food and all. And beside this, we all have a Quality Council of India. They are providing the tremendous training about their one program called WAS training. So these are the few national level knowledge repository that we can refer time to time to, for continuity of our COVID-19 training sessions, because this is the dynamic phase, and every time we are getting some new kind of knowledge uh, uh, from the respective researchers, and then we try to validate it and then include it into the guideline. So recently WHO has updated their guideline about how to wear mask and to whom should wear mask, about the wearing mask. So we should keep our eye on the latest guideline from the respective websites. So this is one of the idea in my mind right now. Thank you so much. Thank you, sir. Thank you for this
Thank you so
opportunity
much,
to be part of your.
Dr. Navneet and Dr. Vikasendu. I think it was very good input from you, both of you. And maybe in the recent future, we will be coming up with many more things. And while going through entire process of COVID academy process and capacity building process, maybe we will be including all those things what you have been suggesting. Now we have got another person here with us, Mr. Pramil Dwivedi. Mr. Pramil Dwivedi is a person who is having many portfolios, many hats with him. Like he is having a media background. He is a very good social worker. He is a Rotarian. He is highly spiritual person. So with all these qualities, the contribution of him as a person, as a support to many institutions is very commendable. And I think he can give us some idea that how these challenges can be met with this process, with the COVID process, how civil society should think about it, and how can we go further with it. So I'll request Mr. Pramil Dwivedi to guide us the way he can and the way he has been doing during all these days. Can somebody unmute Mr. Pramil Dwivedi?
Hello. Hello. Hello, can you hear me?
Yeah,
Hello. Hello.
we can hear you.
Am I audible?
Yes, you are audible.
Okay. So my, I think video is not working well. So we'll go for audio only.
Please.
Yeah, sure. Thank you. So thank you, Dr. Bhanu, for giving this opportunity to share the contribution of media in managing challenges of COVID-19. So that we all are aware that in December 2019, a novel pathogen emerged and within weeks led to the emergence of the biggest global health crisis seen to date. The virus called SARS-CoV-2 causes coronavirus disease, which was named COVID-19 by the World Health Organization. The speedy spread of this infection globally became a source of public worry, and several unknowns regarding this new pathogen created a state of panic. Media became the major source of information about the novel coronavirus. Much like the previous pandemics, we all are aware that in 2003, there was a pandemic called SARS, then H1N1 2009, and MERS in 2012. The media significantly contributed to the COVID-19 infodemics. The role of mass media and public health communications from December 31st, 2019 to till now, and makes scientific inferences. The COVID-19 pandemic highlights multiple social, cultural, and economic issues arising from the media's arguable role. In December 2019, the reports of patients with viral pneumonia in China surfaced. The origin was related to the Wuhan seafoods whole market. Researchers established that the disease has most likely originated from bats, mutated to infect humans, and transmitted by droplet routes among humans. Since the origin occurred in a wet market, the media criticized the Chinese for consuming live animals like bats, snakes, and dogs. Previously known as Wuhan virus and China coronavirus, it was subsequently called 2019 nCoV, and then finally on February 11. Another news was that the ongoing bioweapons research in Wuhan universities has led to the emergence of the virus. It resulted in tweets about United States of America Army troops bringing the virus to Wuhan while attending military games in October 2019. The use of media to spread rumors has been happening for a long time. Now we can share some information on emotional and psychological aspects of the coronavirus. In social media uses has increased manifold and thus has a number of available platforms including Facebook, Twitter, YouTube, Instagram, Snapchat, WhatsApp, and Reddit, along with their Chinese equivalents WeChat, Vivo, Tencent, TikTok, and Totio. People have become accustomed to posting every aspect of their lives on social media. This includes their achievements, worries, and travels on a daily and hourly basis. Since the lockdown, there has been an 87% increase in social media uses by the people. People started gathering information posted on the groups and unknown pages and believing them. Religious pages also started attracting people amid crisis by spreading unscientific information regarding the prevention and treatment of the virus. The implausible claim of the virus affecting the geriatric population made the young vulnerable. This ultimately resulted in a large number of young affected by the virus. This unscientific and unproven fact spread like wildfire in the media and made the elderly go through many psychological and physical terrors. There were reports of old people being removed from family homes and increased emotional abuse cases among them. The next topic I would like to share that the media is a primary source of information and plays a vital role in educating to masses. However, when overly eager sources spread information without proper verification, not only can it be harmful, but it can have unintended consequences. The hydroxychloroquine example fits the scenario. Our proposed mass media model, here we are putting 6 dimensions of the model, media model, which can help a lot. to prevent and eradicate the COVID-19. So these 6 major components, and we recommend evaluating the role of media according to how it performs in each category. This evaluation can serve as valuable feedback for timely and effective interventions using mass media as a tool to prevent and control all future outbreaks. So these 6 dimensions are: the first one is the public health communications. The second one is the health education. The next and third one is the strategies for social distancing, reduction of stigma, discrimination, and prejudice, telemedicine, and the most important is the managing infodemics. Whenever we talk about the public health communications, there is an outbreak, people tend to turn to the media for information. The infodemic stems from 2 words, information and epidemic, and refers to a rapid and far-reaching spread of both accurate and inaccurate information about a disease. During a pandemic, when facts are often mixed with rumors, it becomes difficult to learn essential information about an issue. Controlling rumors and misinformation is required. Social media, which is a source of such propagation, can take fundamental measures to reduce them in a timely way. There should be ways devised to listen and correct the misinformation. In the last, the COVID-19 is a global crisis that has spread throughout the world at a dangerously fast pace. Now, the role and contribution of media plays a huge role in circulating information, influences the public behavior, and can curtail the spread of disease. So this is the conclusion. Conclusions of the talks on the contribution of media in managing challenges of COVID-19. Thank you so much, Dr. Banu. Thank you.
Thank you, Pramilji. Thank you so much. You have given a very nice perspective how media is taking it up and how it should have been taking. So both the perspective you have given. Probably the most important is how society takes from this effort, how society moves with the process, because media is third pillar. So third pillar is if it is taking things positively, probably rightly you have mentioned that in creating rumors, in managing rumors, everywhere media plays a very important role. Even in capacity building also, media has got a bigger role. So if media takes things in the right direction, probably things will go much differently. And it is our responsibility to educate media as well as interact with media so that they get proper information. Most often it is we only who provide illogical information, and then media also gets confused. So very rightly,
it's a very correct. I wanted to add one point,
please.
Dr. Banu.
Yes, sir.
See, the media is also need orientation, because the majority of the journalists are not trained about the beat specific. If we are talking about the health issues, if we are talking about the any other issues like disasters management, so they are not well trained about the beat. They are treating as a general information from each sectors. So they must be trained, they must be oriented. So media orientation is required. The previous many campaigns are run by Uttar Pradesh government, like the spectrum of this disease. It's a rainbow. It's called rainbow. So the media was trained by the departments. The same was happening in polio campaigns. So they needs orientation. Then they can report nicely. Thank you so much.
Sir. Thank you so much for it's an eye opener kind of thing for media also as well as us also.
Yeah.
So with these words, I think we are moving towards the end of the process and today's discussion. And by the end, we were talking about local things, the technical things, and especially the kind of information which is required for capacity building from our opinion. But see, UN is an organization which is taking note of everything globally, and that was the only system which was providing global scenario and making us think differently, because everybody is saying that this is new virus, novel virus, and we need to understand it first. And but while understanding how to go about it, so the kind of information we have been receiving from WHO, UNICEF, and all UN organizations is commendable. Otherwise, we would have been sitting blindly and doing. Everybody would have been doing on its own. So, to us, we have Madhup Bajpayee, Dr. Madhup Bajpayee, regional team leader for UP and Uttarakhand from WHO. So I'll request Dr. Madhup Bajpayee to provide us the inputs, what need to be done further, because the lessons learned, local and global both, is important. But what need to be done further, so that in COVID academy, see, I think the challenge is with us is we do have information for what we have been doing, but the kind of analysis being done at this level, at UN level, is very different. And with that analysis, probably the idea, because government is also doing similar things, private agencies, corporate agencies are also doing their bit. So where are the gaps remaining, which need to be fulfilled by citizens, which need to be fulfilled by, we have seen many visions, Dr. Vikas Sindhu's wisdom we have added, and all the speakers, Professor Melan, Sheila ji, and Dr. Navneet Ranjan, Pramil ji, everybody has given their bit. So how to look at it from UN point of view, and how to go further can be our need, I think. So Dr. Madhup Bajpayee, please enlighten us.
Thank you, Dr. Bhanu. And first of all, I would like to congratulate for the launching of this academy to you and your team. And Sabhi ko mera namaskar. I am Dr. Madhup Bajpayee from WHO, looking after UP and Uttarakhand. So, as rightly you said, that what we need to do, to control this pandemic. So, I mean, there are some simple strategies which are working, like early identification of COVID cases, and that will be done through the testing. And after that, a good contact tracing
following with the active surveillance activity. So, I mean, these are three key points, which we all need to do. And I'm very happy to see that UP state government is, following all three strategies, and they're doing this beautifully. And in result, you can see that UP, in UP, we have not seen second wave so far because of these tried and tested strategies which they have followed. So I would like to give you a brief update about global and national and UP. So I'll take 5 to 6 minutes. Can I share my screen? Dr. Bhanu, can I share my screen? Okay. So
you can, Dr. Praful, you can, I think. Yes.
Okay.
It is reflecting.
Thank you, Dr. Vikas. Thank you. Just a moment. Just a moment. Let me. Okay. So, as we all know that, globally till yesterday, there were around 6.5 crore cases which were reported globally, and more than 15 lakhs deaths. And CFR, as far as CFR is concerned, so CFR is 2.3. As far as India is concerned, so more than 96 lakhs cases have been reported so far, with 1,40,000 deaths. And the CFR, if you compare from global, so it's quite low, it's 1.4%. And similarly for UP, if you see the CFR, so for our state is also 1.4%. So, but as far as cases are concerned, just a moment. Yes, sorry. So as far as cases are concerned, so in UP, there are 5,54,954 cases with 7,924 deaths. The good thing is that CFR in UP is controlled, beside having a large population in the state, that is around 24%. So now I'll move to UP. So at a glance, you can see, as I already told, that there are more than 5 lakhs cases. I was talking about the testing and enhancing of COVID testing. So you can see UP has already completed, more than 20 million tests. And this is a record, this is a landmark in the country, and UP is the first state to achieve 20 million, tests in any state. Total number of active cases are around 22,000, and total deaths I have already informed. So on this map, you can see, in a darker color, like Lucknow, Kanpur, Nagar, Prayagraj, Ghaziabad, and GV Nagar, and Varanasi and Gorakhpur. I mean, these are the districts where we are having high number of COVID cases. So if you see the month-wise scenario of UP, that what happened from the June to till yesterday. So this is very clear. In the June, we were having somewhere around 15,000 positive cases with 475 deaths. And in July, after the lifting of this lockdown, you can see the sudden increase of cases. Then in the month of July, more than 61,000, around 62,000 cases were reported with 933 deaths. If we talk about last month, that was November, from 1st to 30th, there were around 62,000 cases which were reported with 736 cases. So why I am talking about this, you can compare this, number of cases and deaths. I mean, the deaths are even lesser than the month of July, which we have faced. And then again, in the month of September, we have a highest number of cases with highest number of deaths. So what I was trying to say, despite of second wave and the festive season, UP did not have that expected rise in number of cases or in number of deaths. That is quite evident here from this data. And the reason behind this is that the clear-cut strategies which were followed by the UP, like active surveillance, very good quality of contact tracing, and testing, and testing around 40 to 42% testing being done by RT-PCR. So in this you can see the growth rate. Growth rate is continuously declining, and now in the state growth rate is around 0.4%. So if you talk about from 1st to 6th December, so there are around 11,000 cases with the growth rate of 0.3%. So here you can see the total positive cases and the growth rate. So as I said, 0.3 is the state average, but yes, there are few districts like Meerut where we are having still high growth rate, that is 0.9%. Then Ghaziabad 0.7% and Agra 0.7%. And there are few districts like GB Nagar and Varanasi where we are having 0.5%. So we know, I mean, most of the districts, these are adjoining to Delhi. And because of high number of cases in Delhi in second wave, we can see some impact here. So on this map, you can see in darker color, the districts like Ghaziabad, GB Nagar, Kanpur Nagar, Lucknow, Prayagraj, Varanasi, and Gorakhpur. These are 7 districts where we are having more than 20,000 cases. And in white color, I mean, there is no color. There are 45 such districts where we are having less than 5,000 cases in this state. So, but we are having COVID cases across the states in all the districts. So this is about the active cases status of UP. So I have taken few selected districts where we were having high number of cases. So you can see after 19th September, there is a, this line is for Lucknow, and Lucknow is having highest number of COVID cases in the state, more than 72,000, around 73,000. So after 14 or 15 September, you can see the active cases started decreasing. And after 19th October, you can see there is a flat line, or sometimes there is a little bit increase and then dip. And finally, now you can see the cases are, this is the time, after the festive season when we have seen a little bit increase in active cases, but now again, you can see the declining trend. And similarly for the other 4 or 5, high burden districts, you can see the trend is same. So, we can make this inference that, the cases are declining, after this festive season. And you can see we don't have any, significant increase after the October in the state. So this is about confirmed cases, active cases, and deaths. So like if we talk about confirmed cases, so these are 5-6 districts like Lucknow, Kanpur Nagar, Prayagraj, Ghaziabad, GB Nagar, Varanasi, Gorakhpur, where we are still having high number of cases as well as active cases. So, but if you talk about active cases, so here you can see the Meerut is coming on number 2. And Meerut is having more than 2,000 active cases. This is because of recent, surge which we have seen after festive season and because of Delhi. Similarly, you can see the Ghaziabad. Varanasi is, of course, is not near to Delhi, but of course a big urban district with which is well connected through the air and the road and trains. So, I mean, this is the common reason why you see the active cases, more active cases in these districts. As far as deaths are concerned, so in Lucknow, more than 1,000 deaths have been occurred. And after that, Kanpur Nagar is there with 799, then Meerut, Varanasi, Prayagraj, and Gorakhpur. This is a very interesting slide. From the blue line, you can see this is the status of cumulative tests, and from this maroon line, you can see the status of the test positivity rate. So here you can see there is a crossover. The total cumulative tests have been increased, and its trend is increasing. Is still increasing, and here positivity started decreasing. So what I'm trying to say here, and it is around 2.7% if you see overall cumulative positivity, but otherwise if you see on weekly basis, so it is less than 1.5%. So the good thing is that from here cases started declining, but government did not slow the testing. And that is the good thing, that why we are, I mean, that is the only reason why we are not seeing the second wave in UP, because UP did not decrease the testing like some other state like Delhi, Maharashtra, Gujarat, Rajasthan. These were the states where even Kerala, where testing have been significantly decreased after the after the, less number of cases after first wave. And then after some time, we have seen sudden increase. So that was the main reason why, why you have not seen second wave in UP. So what we are doing since last 1 month, we are also analyzing weekly COVID cases data on weekly basis, and we are comparing from status of COVID cases from this week to previous week. So you can see there are 20 districts in different colors. I mean, green color. I mean, the districts which are in green colors. These are the districts where we have seen decrease in number of cases when we compare from the previous week. So last to last week, there were 56 districts where we have seen increase, but now till yesterday, there are only 20 districts where there is a increase in number of cases. In brown color, you can see there are a few districts where we are having more than 75% of increase, and these districts are Amroha, Kanpur Dehat, and Unnao, and Bhadoi. So these are the districts where we have seen more than 75% increase in number of cases. But if you see in actual numbers, so the numbers are not very high. Like for example, if you see Kanpur Dehat, last week there were 31 cases, and this week 62. Similarly for Bhadoi, 31, from 31 to 55. So in numbers, it's not too much, but still there are a few districts where still cases are increasing. So this is another way which we try to analyze that after 3 weeks or in continuously 3 weeks, which are the districts where we have seen increase in number of cases. So these districts are Saharanpur, Muzaffarnagar, Bagpat. This is because of the close proximity with the Delhi. Then Rampur, Badaयूं. And here in Eastern UP, we have got 3 districts, Jaunpur, Varanasi, and Devariya. These are 8 districts where we did not see any decline, in last 3 weeks. So if we compare data for last 4 weeks, so you can see like this week, we are having more than 13,000 cases with 184 deaths, and total tests were then done more than 10 lakhs. And last week, there were more than 15,000 cases with 190 deaths, and around 11 lakhs tests have been done for COVID. And before that, the third week, you can see the total number of cases more than 15,500 with 192 deaths. And before that, only 13,000 cases were reported. With 169 deaths. And you can see in these 2 weeks, the testing were low because of the festive season. Festive season. And after that, you can see, the number of cases have been increased. If you see from 13,800 to 15,500. And you can see the number of deaths also increased from 16. I mean, this is the time period from 9 to 15 December when we were having Diwali and other festivals. So you can see the impact of, people did not follow a social distancing and congregations were occurred. And because of that, you can see the sudden increase in number of deaths as well as cases. But after that, when the government has taken the strict actions and the good strategies were in place, so you can see the decline, deaths also started declining from 190 to 190, then 184, and cases also. But the good thing is that the tests are not declining. It's almost the government is testing 1.5 lakhs tests per day. So this is very good sign. This is about test done and positivity rate. So you can see the highest testing has been done so far in Lucknow, and Lucknow is the district where we are having highest positivity rate, that is 6.2, following with Kanpur Dehat, and then Prayagraj, Kanpur Nagar, Varanasi, GB Nagar, so on. But the positivity is high, but the good thing is that for Lucknow, they are doing more testing. So it is good if any spread is happening. So immediately, the district is able to catch the new pockets, and, they are, doing the control measures. So if you see the proportion wise that how many district is, in percentage how much they are contributing. So Lucknow is contributing 13% of total cases, following with Kanpur Nagar, Prayagraj, and then Ghaziabad. This is about contact tracing. I mean, this is one of the very important activity which UP government is doing religiously, and they're tracking it on daily basis. And you can see, I mean, the Honorable Chief Minister of Uttar Pradesh, he has instructed the government, I mean, the State Department, that for each positive case, there should be a 25 contacts. So you can see, I mean, this is the map. There are 9 districts where we are having more than 20 contacts per positive case. Then there are 26 districts where we are having 15 to 19 contacts. And state average, so if you see the state average, so this is 14 for each positive case. So this is quite good. And because we analyze, we see the data of other states also, this activity is not happening, such a good way in other states. And this is the main activity. If we'll do a good contact tracing, we'll find the transmission and we can break the chain, timely. So this is one of the activity. This is one of the activity which I want to, emphasize that what UP is doing very successfully. There are a couple of slides which is based upon the case investigation form line list which we have analyzed. So here I want to show you, I mean, this is the age group 21 to 40, where we are having highest number of positive cases. So you can see 49% of total positive cases are having in this age group, 21 to 40. And if you see gender-wise, classification, so there were around 69% male and 31% female. And here you can see the age-wise also, male, female. So again, this is the age group, 21 to 40 for male and for the female both. I mean, there is no difference in the gender when we see the highest number of cases. So 20 to 40 years, this is the age group in which, in our state, most of the cases are, getting this positive infection. This is about age distribution of asymptomatic cases. And you can see here that around 50% of cases, again, falling in same age group from 21 to 40 years of age group. So I want to, share here that, these are the positive cases, those who are not having any symptoms, but they are carrying virus with them and they are spreading the infection. So the important thing is that state should, follow and, state should do more, the communication messaging or risk management in this age group from 21 to 40 years of age group, because these are the, people, those who are infected but asymptomatic, and they are going here and there. If they are not wearing a mask or not following a proper COVID related behavior, then, it would be very difficult to stop the infection. This is last slide, that what WHO is doing and what actions, so far we have taken. So we are providing technical guidance to the state, and we are also playing a role in capacity building at state and district level. That is mainly about infection prevention and control, for which we are training, in more than 15,000 doctors we have trained so far with the help of state government. Then we have also done assessment of health facilities and hospitals to see their preparedness to manage the COVID patients. Then when this pandemic started, so initially we have done tracking of more than 7,000 travelers, international travelers, those who came from Italy or, other European countries or China. And the contact tracing, this is still going on. Then we are also supporting in containment zone planning. And for this, we are taking help of polio microplans, which is very useful. And we have already got very good maps. So on this, we are providing trainings to district field teams. And after that, when this activity is going on, so we are also monitoring to ensure the quality and sharing feedback with the district and the state counterpart. We are also filling the case investigation forms, and we are also doing death analysis of COVID cases. Then 2 times, special surveillance activity have been done. It was quite large surveillance activity where door-to-door campaign was done in the state, and we have monitored more than 150,000 houses and shared the real-time feedback with the district and state for corrective actions. Then again, time to time, when we get the request from the state regarding the verification of the quality of contact tracing, so we have also done this, in which in the month of August we have interviewed more than 56,000 positive cases, and we have found that 93% of these positive cases contacts were enrolled by the health team, and the teams were visited the residents of these contacts for the testing and for the other messages. And the last point is advocacy with the officials at all levels, so that we are doing whenever there is any information or any feedback. So we are sharing and guiding the state, and I'm very happy to share that state is very positive, with even critical feedback and negative feedback. State always welcome. Our ACS sir, Shri Amit Mohan Prasad ji, like what Dr. Vikas was telling, there is a regular review which is going on for last 6 months on daily basis. And that is the key, on day-to-day basis, when all the senior officials, from different department, and they sit together, and partners like UNICEF and WHO. So we are also part of this core committee, and each and every point, is discussed in this meeting. And of course, the health department is a nodal department for this. And I am very happy to see such a strong political will and leadership from the top at the state level, like at the topmost level, like a chief minister, then, from the ACS sir and others. So, these were the few reasons, why UP is doing different and doing good. That first, they are taking negative and critical feedback from independent agencies like WHO and UNICEF, and their strategies there, they have built up the infrastructure like anything. Nobody could have thought like that UP is going to have 150,000 beds in such a short time, and they will maintain the testing like 1.5 lakh samples testing every day, and it is going on for month and month and month. So these are the good things which state is doing, and it's commendable, and WHO already applauded at national level and international level about the activity of UP government. Thank you, and over from my side.
Thank you, Dr. Madhip. Thank you so much. I think you have given a very nice picture, and really it was very informative as well as encouraging also, that how technical guidance and advocacy, then containment zone planning, strong will of the head of the state. All these things are adding very positively, and that's the reason why UP could do so much, which most of the nations could not do. UP is also as good as a nation, because it would have been 5th nation if we see it from population wise. So I think this is going to help us a lot. Now, without wasting time, I'll go to Dr. Nirmal Singh from UNICEF to see how health priorities for children and all relevant groups, what he thinks could be informed. So, Dr. Nirmal Singh, please.
Thank you, Dr. Bhanu. Good afternoon, everyone, and Honorable General Shahi, whom we have listened, Professor Menon, Dr. Vikasendu, Dr. Bhanu Mitra, Dr. Ranjan, Professor Harsh, Professor Mishra, and Mr. Vikrant, Mr. Pramil, and Dr. Madhu, and all the participants of this inaugural launch of COVID-19 Academy in Uttar Pradesh. First of all, I am very pleased to deliver the address on behalf of UNICEF in Uttar Pradesh. And before talking about the health priorities of UNICEF, let me also say that UNICEF is working with government all across the state for education, child protection, water and sanitation, disaster risk reduction, apart from the health and nutrition issues. Now coming to the maternal and child health issues, every day approximately 67,000 babies are born in India, and that is 1/6 of the world's childbirth. And every minute one of these newborn dies. The day of birth is the actually the riskiest day for both the mother and the newborn, as nearly 40% of the newborn deaths and almost half of the maternal deaths occurs on the day of birth. Measures to ensure that every woman delivers in a health facility assisted by a skilled birth attendant are the key to prevent these deaths. Increases in the number of women delivering in health facility has contributed in reducing newborn death and maternal death. And government of Uttar Pradesh is actually doing very good programs in that terms. It is noted that UP has maternal mortality ratio of 258 maternal deaths per 100,000 live births as per the AHS 2013, which is available, while SDG target is to reduce maternal mortality up to 70 maternal deaths per 100,000 live births by 2030. For neonatal mortality, the state has declined from 48 in 2007 to 32 in 2018 as per the SRS data, with newborn death accounting for approximately 65% of the under 5 deaths. 3/4 of the newborn deaths occur in the first week after birth, and with 36% occurring on the day of birth. And also for newborn mortality, SDG target has to reduce the neonatal mortality up to 12 newborn deaths per 1,000 live births by 2030. So it's still a long way to go. And prematurity, neonatal infections, birth asphyxia, and congenital malformation are among the major causes of newborn death. Ensuring access to quality care and delivery in health facility has been key, because nearly 46% of all maternal deaths and 40% of neonatal deaths happen during labor or the first 24 hours after birth. India and so UP has also significant progress in the reduction of child mortality, and the focus now needs to be on the newborn and reaching the most marginalized children, with special focus on the girl child. We just listened the ma'am Sheila also. She also emphasized on that terms. India contributes to nearly 1/6 of the global burden of under 5 deaths and around a quarter of the global burden of neonatal deaths. So UP is also. India is the only large country in the world where more girl babies die than boy babies. This discrimination begins even before birth, with an adverse sex ratio for the female child, meaning more boys are born than girls, and continues across all stages of child's life. Statistics reflect that community attitudes, with fewer hospital admissions for girls than boys, showing that parents sometimes give less attention to girl newborn. And in Uttar Pradesh, we have almost more than 80 sick newborn care units, where only 36.27% admission for the girl child had been done in recent past. Newborn deaths can be prevented with very simple and inexpensive intervention. Preventing newborn death requires concerted actions to all levels of society, from families, communities to healthcare workers and government. So UNICEF is working in partnership with the government in implementing its maternal, child and newborn health program across the state to make sure that they reach every child and every parent. The need of equitable access to health care for every girl child warrants an intensification of our combined efforts to bridge this gap and ensure equitable access to health care for every girl child. The period around birth constitutes a critical window of opportunity for prevention and management of maternal and newborn complications, which can be otherwise proved fatal. UNICEF programming around maternal, child, and newborn health seeks to reduce inequities in care, strengthen health system, and incorporate resilience and risk-informed planning. With a combination of adequate investment in the most disadvantaged community and committed leadership, millions of excluded mothers and their children can be saved. UNICEF supporting various programs and flagships of Government of India and Government of Uttar Pradesh, which includes the facility-based newborn care, home-based newborn care, home-based young child care, routine immunization, public health preparedness during natural disasters like floods, acute encephalitis syndrome or Japanese encephalitis prevention and control, some maternal health programs like Laksha, Pradhan Mantri Surakshit Matratva Abhiyan, which we call PMSMA, addressing malnutrition and severe acute malnutrition, anemia prevention and management, recently launched by the Pradhan Mantri Anemia Mukt Bharat, nutrition during pregnancy and vitamin A supplementation. As said by Dr. Madhup also, UNICEF also supported Government of Uttar Pradesh in COVID-19 response, which includes IEC, the promotion of corona appropriate behavior, community surveillance, migration tracking, infection prevention control measures, monitoring of high home isolation cases, advocacy and building capacity of media persons, use of social media platform, and advocacy appeals to religious leaders, supporting continuity of the newborn or maternal health services. This was the one of the important component, and Government of Uttar Pradesh has very well done in this regard, that during the pandemic situation, they could continue the newborn and maternal health services. And same way, we will continue upcoming plans for the management of COVID-19. I will stop here, and at last, on behalf of UNICEF, I would like to congratulate Uttar Pradesh State Disaster Management Authority, Sphere India, IAG, UP, Lucknow and Gorakhpur Universities, HCL Foundation and other partners for the start of this initiative. And certainly people of Uttar Pradesh will get benefited from it. Thank you, Dr. Bhanu. Over from my side.
Thank you, Dr. Nirmal. Thank you so much. I think it was great insight what you had given. And I think we got UN perspective very rightly, and that will add lots of value to our COVID Academy Uttar Pradesh. Now, I would like to invite Senior Manager of Sphere India, Dr. Hena Hejazi, to give her comments and how emergency preparedness can be strengthened. That she can explain nicely, I think.
Thank you so much, Dr. Banu. It's been 3 hours that we are in this session, and it's happening for the first time. It's quite heartwarming to see an overwhelming enthusiasm of a diverse technical expert group. And all thanks to you for bringing in, and to UPSTMA for bringing all the relevant stakeholders on board, including the academic institutions, media, global experts and all. So thanks to you. I wish to apologize on behalf of Mr. Vikrant, who could not make it and had to attend and step in into another meeting, which is very urgent. At the outset, let me express my heartfelt gratitude to the Honorable Lieutenant General R.P. Sahi sir for chairing this very important session and for setting the tone of the launch event for the COVID Academy in the state. I'm equally thankful to a very to all other honorable guests who have a diverse and a very rich experience in the field of disaster management, health, SDGs and all. So it was really very insightful and very informative session, and we had a lot of lessons to learn from the sessions that have been going on from the past 2-3 hours. And we are extremely thankful to UPSTMA, to IAG UP, who have been instrumental in lending support to Spare India for rolling out the state academy sessions on COVID preparedness and response in the state of Uttar Pradesh. Our aim is basically to synergize our commitments vis-a-vis emergency preparedness and response in the state. We'd like to take this opportunity to also compliment the state authorities for their commendable contributions in terms of the response efforts and the innovative strategies that have been employed to contain the pandemic, which VC sir has very beautifully interpreted in his inaugural opening speech. As has been already communicated by Dr. Banu sir, we are rolling out 9 technical sessions, of which VC sir has also given elaborated. But what is special about these sessions is that they will be in local regional language, which is Hindi. So Hindi translated versions and the customization of these modules have happened earlier in consultation with UPSTMA and IG UP to make it more specific to the audience. When we come to the audience, this is basically for the outreach workers, for all the volunteers, which include Aapda Mitra volunteers, which include health workers, Red Cross, Civil Defense, NCC, NSS volunteers, sarpanches, panches, who are there in the field. And during this pandemic, we saw a large number of these community workers and volunteers providing a lot of social protection support to those who were affected and providing their rendering their services. But what we observed is that most of them were doubtful about the correctness of the approach within the given context of COVID. I mean, I remember our earlier deliberations with Dr. Banu when we basically started our designing of this and how we talked on the methodology, targeting, on the evaluation. I would agree and second Dr. Vikasendu, who has said that there has we need to keep the audience enthused, and some of the earlier audiences and committees and committees that we have been engaged with, we do not find the same enthusiasm. So we need a cadre of new educated youth who will keep it. I mean, he talked about the Agra model of volunteers. It has almost 2,500 volunteers. So these initiatives are also about engaging those people, reaching out to those people so that we can create a cadre of volunteers out there in the field to kind of help us meet our objectives. So apart from the targeting, it's also a humble effort to kind of enlarge and develop scientific technical knowledge about COVID-19. So that these volunteers can directly interact with technical experts on and clear their doubts, and they are innumerable things that we intend to do. Apart from and besides this, it is also an initiative to actually map some of the volunteers and related resources. We have a whole lot of civil-based organizations, faith-based organizations, community-based organizations, corporations, I mean, and formal, informal groups and individuals in UP who we want to kind of bring in the ambit of these during these capacity building processes, so that we build a cadre of trained volunteers at the district, sub-district and community level. So that is our endeavor. And also on the capacity building of volunteers on a wide range of technical topics, which will be delivered by subject experts, which I think UPSTMA and IG UP is already working on, and also to leverage the capacity of the volunteers to deliver a coordinated and benchmarked response within their zone of influence, like villages, slums, cities, districts, blocks. We also understand from a lot of technical experts that there are already existing committees and networks and setups who have already undergone some training. So these trainings can serve as a refresher for those people. It would be our endeavor, and it would be our request to the UPSTMA and to the IG to have these official communications to all the DDMAs, line departments regarding the participation of IG members and all the line departments and a maximum of all the social network or organizations, dissemination of this information in all your existing official WhatsApp, so that we have maximum people availing the benefits of these capacity building initiatives that we intend to roll out. So because we are running short of time, I would not stretch it too much, but I understand that this pandemic has exposed us to a lot of fundamental frailties in terms of health, infrastructure, governance, health essential services, and these capacity building initiatives will set the initial precedents and an initial stage whereby we will try to understand and gauge understanding on what are the deeper capacity building needs that are coming from the field, which was also pointed out by Dr. Banu in the course of the sessions. So I think I'm again thanking the organizers and UPSTMA for all the support. And with this, I would like to hand it over to Dr. Banu. Thank you so much, sir.
Thank you. Thank you, Hannah. I think you have given a very nice end to it, and you have taken everything into account. I'll not take much time. I'll thank everybody who has participated and all those resource persons who have supported. Only one advice, I think, to our team, that after we have got 9 or 10 sessions, so after 4 or 5 sessions, we may have one more round of discussion like this, so that the remaining 5 sessions and how to go about after 10. So these could help us to go further, because let's maybe what is going to be tomorrow is not known, but let's take it that COVID is going to stay for some time with us. It's not going now. So keeping that in mind, we need to sit regularly and at the same time improve our understanding as well as the approaches, so that community is always taking it in a positive manner, and all those things post COVID things are taken in the right manner, right? So thank you so much, everybody, and it was wonderful understanding. Though more than 3 hours have passed, so we need to take leave today, and we will be meeting very soon again. Thank you very much.